Hello, everyone. Welcome to our webinar. We will be discussing the mental health impacts of social media on adolescents. We will be analyzing the increasing rates of anxiety, depression, and body image issues linked to social media and how nurses can address this in practice. Today, you'll be hearing from Jessie, Rachel, Stephen, Mitch, and myself, Jamie, who will be taking us through different topics. Today's agenda will take us through the growing concern of social media's impact on mental health, identifying risk factors such as excessive screen time and mental health outcomes, pharmacological interventions and the role of psychiatric medications, non-pharmacological approaches such as therapy and self-care, and the role of the nurse, screening, assessments, and patient education. We hope you enjoy our webinar on this very important topic.
Good morning, everyone. I'm Jessie. Thank you for joining today's webinar on the mental health impacts of social media on adolescents. My section of the presentation will focus on the growing concern of how social media is influencing the mental health of adolescents, particularly in relation to anxiety, depression, and body image issues. As we explore this, we'll also discuss how nurses and healthcare providers can address these concerns in their practice. Let's start with the role social media plays in the lives of adolescents. According to a recent statistic, nearly 95% of teens have access to a smartphone, and approximately 85% are active on at least one social media platform. This isn't surprising, considering that social media offers a sense of connection and validation and entertainment. Platforms like Instagram, TikTok, and Snapchat have become integral parts of their social interactions. However, while these platforms offer benefit, they also introduce significant risks to mental health. One of the most alarming trends is the increase in anxiety and depression among adolescents that correlates with social media use. Studies have shown that excessive time spent on social media platforms is associated with higher levels of anxiety and depression. In particular, platforms that emphasize idealized images and lifestyles, such as Instagram, have been linked to feelings of inadequacy, loneliness, and depression. Let me pause here and ask you all a question. How many hours a day do you think the average adolescent spends on social media? As you can see from the data, the average adolescent spends about 3 to 4 hours a day on social media, which is quite a significant amount of time when you consider the influence these platforms have on their mental state. The comparison trap and its impact on body image. Another major concern is the impact social media has on adolescents' body image. Social media is a powerful platform for showcasing beauty standards that are often unattainable. Teens are frequently exposed to filtered images, influencers with idealized body types, and heavily edited photos that just set unrealistic standards. This can lead to body dissatisfaction, low self-esteem, and even eating disorders. A 2024 study found that 60% of teenage girls reported feeling negative feelings about their appearance after using Instagram. This phenomenon is further linked to the rise of eating disorders among teens. These feelings of comparison are not just limited to body image, they can extend to lifestyle, social status, and personal achievements. Adolescents often internalize these comparisons, leading to anxiety and depressive symptoms. So, what exactly is happening at a psychological level? Social media platforms work on algorithms that promote content based on what is most likely to engage users. Unfortunately, this often means that negative or anxiety-provoking content like sensational news stories, fear-driven posts, and idealized lifestyles get more visibility. The more adolescents engage with this type of content, the more their mental health is at risk. Research indicates that social media algorithms that prioritize sensationalized or idealized content heighten anxiety and stress among adolescents. The constant exposure to social comparisons and the desire for validation via likes and comments creates emotional exhaustion and performance anxiety. Let's take a moment for a hypothetical case. Imagine an adolescent named Emma. She's 16, spends several hours a day on Instagram, and regularly compares her body image to influencers that she follows. After seeing a photo of a friend at a party with dozens of likes and comments, Emma feels isolated and begins to worry about her own social standing. How do you think Emma might feel after spending so much time on social media, especially if she feels like she's not measuring up? And more importantly, what steps could a nurse take to support Emma in navigating these challenges? Feel free to type your thoughts in the chat. Now that we've explored the problem, let's talk about what we as nurses can do to help. As nurses, we are in a unique position to support adolescents who may be struggling with the mental health impacts of social media. Here are a few ways you can make a difference. We can promote media literacy, educating adolescents on how social media works and how it can distort reality, helping them understand that what they see online doesn't always reflect real life, and that can be empowering. We can encourage healthy boundaries, discuss the importance of setting boundaries with social media, such as limiting screen time and being mindful of the content they consume. We can provide emotional support by creating a safe space where adolescents feel comfortable discussing their mental health. As a nurse, we can help identify early signs of anxiety or depression and refer them to mental health professionals when necessary. And finally, we can foster self esteem by encouraging activities that help build self esteem outside of social media, such as hobbies, sports, or volunteering. To conclude my portion of the webinar, social media presents a double edged sword. It can provide connection, but it also has the potential to significantly harm adolescents' mental health. As a healthcare professional, we need to be aware of this growing concern and take active steps into supporting our young patients in managing their social media use. By promoting awareness, setting healthy boundaries, and offering emotional support, we can help mitigate the negative effects and guide them toward a better mental health. Thank you for your attention. I'll now pass it back to my colleague to continue the discussion.
Hi, I'm Rachel, and today I'm exploring the complex relationship between screen time and adolescent mental health. We'll look at how excessive use impacts everything from sleep disruption and social comparison to cyberbullying and behavior patterns that mirror addiction. We'll also touch on how content exposure and types of screen activities play a huge role in shaping teen well-being. Did you know that crossing the 3-hour daily social media use mark can actually double an adolescent's risks of developing mental health issues? This isn't just a casual concern, it's a serious issue with long term effects. We are not simply talking about feeling a little down from time to time. Research has shown that heavy social media use can significantly increase the likelihood of teens experiencing conditions such as depression, anxiety, and a range of behavioral problems. What's particularly alarming is that even teens who start out with a clean mental health slate are not immune to the dangers of excessive screen time. In fact, a comprehensive study involving American teens aged 12 to 15 found that those who spend more than 3 hours each day on social media were twice as likely to report negative mental health symptoms, including persistent anxiety and depressive feelings. This digital dilemma is becoming a growing concern, especially as social media continues to be a central part of adolescent life. Understanding and addressing this risk is more important than ever, helping to protect the mental well-being of our youth. While video gaming has certainly seen a concerning rise in addiction related issues, the real story goes beyond just gaming. It lies in the nature of screen time itself. Not all screen time is created equal. When teens engage with screens for educational purposes or to learn something new, the effects can generally be positive. However, when it comes to mindless scrolling through social media or endless video consumption, that's where the real trouble begins. It's not just about how long teens spend on screens, but also about how they engage with them. The key challenge is helping teens navigate their digital worlds in a way that promotes positive outcomes. By guiding them towards more constructive digital engagement and teaching them how to build healthy screen time habits, we can mitigate the risks of excessive and passive screen use, leading to a more balanced and mentally healthy relationship with technology. Social media is often viewed as a treasure trove of information and connection, but it's also a potential minefield, especially for young minds. While it offers countless opportunities for learning and engagement, it can also expose teens to harmful content. From extreme viewpoints to unrealistic body standards, the digital worlds can have a profound and sometimes unexpected impact on adolescent development. This is particularly concerning for young women, as research shows a clear link between exposure to certain types of content and the rise in eating disorders, which is a red flag we cannot ignore. What's even more alarming is the interactive nature of social media. It isn't just passive consumption. This constant engagement can actually alter brain regions responsible for emotional regulation, making adolescents especially vulnerable to the negative impact of content they encounter. This is why it is crucial to be aware of the digital environment teens are navigating every day. What happens when checking social media feels less like a choice and more like a compulsion? We're starting to see patterns that mirror addiction, where teens experience loss of control over their social media use, leading to withdrawal symptoms when they can't access it. This compulsive behavior often comes at the expense of other important activities, like schoolwork, physical exercise, and even in person social interactions. Over time, this can create a slippery slope, impacting overall well being, both mentally and physically. It's not just about spending too much time online, it's about how that time is affecting your teen's life. That's why early recognition of these patterns is so important. Identifying when social media use is becoming problematic allows for timely intervention and support, helping to prevent further negative consequences and encouraging healthier habits. Have you ever wondered why teens always seem so tired? Late night screen time might be the major culprit. The constant exposure to screens, especially before bed, disrupts sleep quality and leads to inadequate rest, resulting in daytime drowsiness. But the consequences don't stop there. This disruption can trigger a domino effect, impacting not just physical health, but mental well being too. Chronic sleep deprivation is strongly linked to an increased risk of depression, anxiety, and other mental health issues. It can also make it harder for teens to concentrate, perform well in school, and maintain healthy relationships. That is why it is so important to encourage healthy sleep habits and set limits on screen time before bed. Protecting teens' sleep is essential for safeguarding their mental, emotional, and physical health, helping them function better during the day and feel more energized. Social media often presents a highly curated version of reality, where the highlights of people's lives are carefully shared, leaving out the struggles and imperfections. For teens, especially young women, constant exposure to these seemingly perfect lives can fuel feelings of body dissatisfaction and contribute to depressive symptoms. This creates a silent battle against unrealistic standards that are often unattainable. Beyond the pressure to look a certain way, there's also a constant need for social validation through likes, comments, and shares. During adolescence, when identity is still being formed, this can significantly damage self worth as teens start to tie their values to external approvals. The impact of these pressures is far reaching, making it crucial to foster a healthier relationship with social media and help teens build resilience against its negative effects. In the digital age, bullying doesn't stop at the school gates. Cyberbullying can follow teens anywhere, anytime. The result? Increased risk of depression, anxiety, and a host of other mental health challenges. Victims often experience higher levels of social anxiety and lower life satisfaction. The persistent nature of online harassment can lead to long term mental health issues, so it's important to implement education, support systems, and online safety measures. Next, Stephen will be discussing the pharmacological interventions.
Hello, my name is Stephen, and I'm going to be talking about pharmacological interventions and the role of psychiatric medications. Medications should help supplement a care plan that includes CBT. Medications can have unintended and negative effects in our youth population. Medications, for the purposes of this presentation, can be broken down really into two categories. Those medication categories can be those prescribed by a health care professional and those that are recreational in nature. It's important for clinicians to know what patients are taking, and it's also important for clinicians to create a safe environment where it allows the patient to disclose what they're taking. So we have a better understanding of what the interactions of these medications will be. So today, of course, we live in a very social media driven world. It's impossible to really do business, to work, or play without platforms like Facebook and Instagram. And unfortunately, it's very easy to scroll through Facebook and Instagram and see what is a very sanitized version of a person and compare that to yourself and kind of start to feel bad about your situation. So we know that social media can have very negative effects on youth mental health. We also see rising depression, anxiety, sleep disorder, body dysmorphia, body image issues now presenting in record numbers related to social media. There is a strong correlation between social media use and decreasing life satisfaction. However, there's no specific medication to treat social media induced medical health issues. So when I speak about non-prescribed medications, I'm speaking about recreational pharmaceuticals or substances that people take to self-medicate. These could be any substance that are not prescribed by a regulated health clinician. They could be prescribed by a clinician for someone else, or really, actually, they could be prescribed by the clinician and maybe misused. Over-the-counter medications such as Advil, Tylenol, Tylenol ones with codeine, any illegally obtained medications like Ambien or Xanax, illegal substances or drugs like cocaine, LSD. Shrooms are commercially available now here in downtown Toronto anyways. Regulated substances like alcohol or marijuana are also very much available. So, as there is no specific medication for social media induced mental health issues, we treat the symptoms the same way we would treat any other depression, anxiety, body image issues. It should be in conjunction with some type of supportive therapy like CBT. But we can use SSRIs, which increase serotonin levels by inhibiting reuptake, and fluoxetine, sertraline are medications in that classification. SNRIs inhibit serotonin and norepinephrine reuptake. Phenylephrine, duloxetine are some medications in that class. Benzodiazepines, anxiety control medication, lorazepam, clonazepam, pretty common in that class. Antipsychotics work on neurotransmitter receptors like dopamine and serotonin, and quetiapine is a big one there. Mood stabilizers, the mechanism of action, it's not clearly understood with these ones, but lithium and valproic acid, just noting that lithium has a very, very narrow therapeutic window. And stimulants, which increase neurotransmitters, really for the treatment of ADHD. And one sort of emerging one is microdose LSD. And so, like anything we do in healthcare, there's risk and benefit, and that's certainly true for medications. The unfortunate part here with treating social media induced mental health issues in our youth is that a lot of the medication can actually cause more harm than good. And so things like SNRIs, like phenylephrine, are actually not intended for people under the age of 18 due to the risk of self-harm and a very, very strong risk for suicidal ideation. SSRIs like citalopram can cause serotonin syndrome and suicide ideation. Benzodiazepines like clonazepam actually can cause dependency and have very, very severe withdrawal effects. Antipsychotics like quetiapine also come with risks for suicidal ideation and self-harm. Mood stabilizers, like I said in the last slide, have a very narrow therapeutic window and really aren't indicated for children under the age of 12. Stimulants like lisdexamfetamine can be misused and cause dependency.
Hello everyone, welcome to the next section of our webinar. My name is Jamie and I will be speaking about non-pharmacological interventions. As we begin, it is important to first understand what a non-pharmacological intervention is. A non-pharmacological intervention, or an NPI, from a mental health perspective is to improve the health and well-being for those experiencing mental health illness through methods of lifestyle changes, therapies, behavioral techniques, and does not primarily rely on medications. Some examples of NPIs can include cognitive behavioral therapy, psychosocial interventions, mindfulness-based stress reduction techniques, yoga and relaxation, and internet-based interventions. As we move through the next few slides, we will grasp an understanding of why NPIs are important and some examples of interventions that can be used. Now, before we dive into specific types of interventions, we need to understand why NPIs are an important aspect of mental health support. With the rise in social media use and its potential negative effects on body image, self-esteem, and overall mental health and well-being. First, internet addictions, including social media, can be harmful to one's mental health. It can lead to isolation, increase in sedentary behavior, and increased screen time, as well as it can affect academic performance, reduce quality of life, and can contribute to depression, anxiety, and obesity. NPIs can be used independently or in combination with pharmacological interventions or any other intervention. Therefore, international evidence-based treatment guidelines recommend non-pharmacological interventions as a gold standard approach to treatment and support of mental health disorders. Now that we understand a little bit more about what an NPI is and why it's important, we are going to talk about some NPIs that can be used for individuals struggling with mental health illness in relation to social media. First, we will talk about cognitive behavioral therapy. For those who do not know what cognitive behavioral therapy is, it is defined as a practical, evidence-based therapeutic approach that allows an individual to understand day-to-day problems and examine how they make sense of what is happening and how these perceptions affect the way they feel. Cognitive behavioral therapy consists of a structured, time-limited approach that consists of approximately 6 to 20 sessions. It's problem-focused while also focusing on the therapeutic therapist-client relationship. Cognitive behavioral therapy can assist any individual experiencing anxiety, depression, bipolar disorder, OCD, addictions, and more. It consists of an individual focusing on developing skills and goals for managing day-to-day life. This can include any individual struggling with a social media addiction, how they can identify it, question it, change the thoughts, attitudes, and beliefs related to emotions that cause that individual difficulty. So, as we think of adolescents struggling with social media addictions or poor self esteem and mental health issues due to social media, cognitive behavioral therapy could be a great option where they can uncover their feelings and emotions, work towards a goal of reducing these feelings and improving overall mental well being. The therapist will work closely with the individual to come up with a specific and reasonable skill that can be applied in day to day life. This can include reducing screen time, limiting time on social media apps, or turning notifications off for social media apps. Next, we will talk about self-care and relaxation techniques. First, what is self-care? Self-care is an intentional action taken to enhance physical, emotional, and mental well-being. It has been shown to improve mental health, enhance self-esteem, self-worth, and lessen symptoms of anxiety and depression. When we talk about self-care, it's important to note that there is no one-size-fits-all. It is all about discovering and implementing things that make you happy without force. Examples can include snuggling with your pet, enjoying time outdoors like running or walking, meditating or journaling, crafting, spending time with family or friends, or whatever it is that makes you happy. Self-care is less about doing certain things and more about setting boundaries with yourself. This could be in relation to social media by setting time limits on social media accounts or turning off notifications in general for social media apps. Relaxation techniques are a form of psychotherapy where therapeutic exercises are designed to assist in decreasing tension and anxiety. This could mean you are experiencing a high heart rate and palpitations due to your anxiety, and the goal with relaxation techniques is to reduce those unpleasant responses. Examples of relaxation could include box breathing, which includes 4 steps of breathing. Breathing in through the nose for 4, holding the breath for 4, breathing out for 4, and holding for 4, and repeat. Guided imagery, and even yoga, where the practice focuses on controlling the breath and moving the body. Additionally, there are online resources available to you, such as the Calm app. It has music, meditation, breath work, reflection, and more to help ease the mind and promote relaxation. Bounce Back is a free CBT service for those over the age of 15 in Ontario. And Connects Ontario is a free online service where individuals can call, text, email, or even live chat and have access to mental health support. All of these options assist in supporting an individual's mental health journey, including those struggling with social media addictions or mental health issues impacted by social media. Now that we've learned a little bit about non-pharmacological interventions, let's do a little pop quiz to test your knowledge. We will take up the answers on the next slide. Number 1, which of the following is a common mental health issue adolescents may experience due to excessive social media use? Increased self-esteem, anxiety and depression, improved sleep quality, or enhanced social skills. Number 2, social media often leads to comparison with others, which can negatively affect an adolescent's body image and self-worth. True or false? Number 3, which of the following is a key component of cognitive behavioral therapy for addressing negative thought patterns in adolescents? Medication to control anxiety, identifying and challenging negative thoughts, ignoring feelings of stress and anxiety, or practicing mindfulness. And now number 4 is a short answer where you're just going to think about what comes to mind when you hear this question. So number 4 is describe how setting a no phone rule an hour before bed can contribute to improving an adolescent's sleep quality. And we'll take up the answers on the next slide. Okay, now that everyone's had a chance to think about their answers, let's take up the quiz. Number 1 was which of the following is a common mental health issue adolescents may experience due to excessive social media use? And the answer to this was anxiety and depression. Number 2, social media often leads to comparison with others, which can negatively affect an adolescent's body image and self-worth. The answer to this is true. Number 3, which of the following is a key component of cognitive behavioral therapy for addressing negative thought patterns in adolescents? The answer to this is identifying and challenging negative thoughts. Number 4, describe how setting a no phone rule an hour before bed can contribute to improving an adolescent's sleep quality. Reducing screen time before bed helps promote relaxation, improve sleep patterns, reduce anxiety, leading to overall better sleep quality. Just as we talked about non-pharmacological interventions, setting screen time limits on these apps can also help improve overall well-being, like getting outside instead or better sleep. These are all things that we as nurses can help educate and improve in an adolescent's life as well. Good job, everyone. To conclude my portion on non-pharmacological interventions, it is important to remember these interventions are an impactful aspect of mental health support, especially with the risk of social media use in younger adults and the potential negative impact it can have on their mental health. We talked about different interventions, including online supports that can be used on a daily basis, yoga, walking, cuddling your dog, and the importance of setting boundaries, like setting time limits on social media apps or turning off notifications. And most importantly, always reach out if you are struggling or know someone who is. Thank you for your time and attention, and next, Mitch will be speaking with you about the role of the nurse.
The role of nurses: screening, assessment, and patient education. Nurses play a critical role in identifying and addressing the mental health impacts of social media on adolescents. As frontline healthcare providers, we as nurses are in a unique position to screen, assess, and educate adolescents on social media use. Integrating effective strategies into nursing practice is important for healthcare professionals to promote patient resilience, self-care, and overall well-being in adolescents navigating social media. Role of nurses screening adolescents using social media. Why screening matters. Early detection prevents worsening symptoms, as nurses are able to screen adolescents using social media for early signs of anxiety, depression, and body image concerns linked to social media use. Screen tools that can be used are the PHQ-9 test for depression, the GAD-9-7 test for anxiety, and the SCOFF test for body image and eating disorders. Key questions that can be asked are: how do you feel after using social media, and have you experienced online bullying? Assessment strategies for nurses. Observing behavioral and emotional changes. Mood variability. By noting fluctuations such as increased irritability, sadness, or anxiety following social media use. Social withdrawal. Look for signs of isolation, reluctance to engage in face-to-face interactions, or reduced participation in school and extracurricular activities. Academic impact. You can identify any decline in academic performance that may correlate with social media use. Identifying specific red flags. Cyberbullying impact. You can assess for emotional distress after using a mobile device, reluctance to share online experiences, or physical symptoms like headaches or stomach aches that are linked to stress. Excessive social media use. You can evaluate time spent on devices or ask about sleep patterns and whether screen time interferes with daily routines. Lastly, self-esteem and body image concerns. You can inquire about dissatisfaction with appearance, the influence of idealized images, or comparisons made with peers and influencers online. Comprehensive assessment techniques. Structured interviews, which use open-ended questions to understand the adolescent's online behaviors, feelings, and perceptions. Lastly is collateral information, which you can consider gathering insights from parents, teachers, or counselors to understand changes in behavior over time. Patient education and health promotion. Promoting healthy social media habits. Setting limits, which teaches strategies like using app timers, scheduling tech-free periods, or balancing screen time with offline activities. Also, mindful use, which encourages mindfulness practices during digital interactions, such as taking pauses to reflect on emotions or impact of online content. Coping and stress management strategies that can be used for adolescents using social media. Self-care techniques, which introduce practices like physical exercise, meditation, journaling, or engaging in creative hobbies that can mitigate stress. Resource identification, which informs about available support resources such as counseling services, school mental health programs, or community support groups. Empowerment through education. You can discuss how building self-esteem and resilience can protect against negative online experiences and also provide practical examples like maintaining a gratitude journal or engaging in regular physical activity. Family and community involvement. Family discussions, which encourage families to have open dialogues about social media usage, setting collective rules that promote social media well-being. Also, community programs, which highlight local and school-based programs that educate on digital literacy, and mental health and fostering a supportive network for adolescents using social media. The call to action for young adolescents using social media. You can integrate mental health screenings by routinely assessing adolescents for signs of distress related to social media use. We can educate and empower by providing guidance on healthy social media habits and teach digital resilience. We can collaborate with families and schools by working together to create a supportive environment for adolescents' well-being. And we can also advocate for mental health awareness by supporting policies that promote safe social media use and mental health resources in schools and communities. My final thought is by taking an active role in screening, assessment, and education, nurses can help adolescents navigate the digital world with confidence, resilience, and self-care.
Thank you for joining us today as we explored the growing concern of social media's impact on mental health, the risks associated with excessive screen time, and how pharmacological and non-pharmacological interventions play a role in supporting adolescent well-being. We also discussed the crucial role of nurses in screening, assessment, and patient education to guide teens through these challenges. A special thanks to Jessie, Stephen, Jamie, and Mitch for their valuable contributions. Remember, understanding these factors is key to navigating the digital landscape and supporting healthier outcomes for today's youth. Thank you for watching and listening, and have a great day.